you can turn your camera off if you don't want to be visually filmed, but hopefully you do. We won't be doing anything untoward apart from putting the recording up on our website to be as open and transparent as we possibly can be.
Andrew, if Michelle can't locate the presentation, I can go ahead and give a verbal presentation, and we could always forward the slides.
Okay, should we do that because we're quite pressed for time?
Yes, certainly. I'll crack on, shall I?
Yeah, no, please do. Okay,
so you must also give me a warning when I'm talking too much and tell me to, hurry up. So I'm Davina Nicholson. I'm the clinical lead at Time to Talk West Berkshire, which is the youth counselling service. We've actually been around for a very long time. The charity was established in 1985, and we've been counselling children and young people between the age of 11 and 25 since then. And we are BACP accredited, so we are quality controlled. And Andrew and Alice and the others at Healthwatch asked me to do a short presentation on the youth mental health situation in the light of COVID-19 and the year that we've had. And I wanted to start by a quote that I got from a meeting with the Children's Society, Young Minds, Youth Access, and many counselling services, youth counselling services from all over the UK. And I'm going to read two quotes. These will be on the slides when you eventually get them. The first one says, "The COVID-19 pandemic has had a significant impact on children and young people's mental health. Whilst services have adapted in many ways, those with pre-existing conditions have said that their mental health has worsened." So I want to just very quickly give you a little anecdote there. A young man who has been coming for counselling with us, and he is on the autistic spectrum, and he found pre-COVID-19 and all the lockdowns that he was very encouraged by groups that he used to go to, and that used to help him connect with people, and he hasn't been able to go to any of those groups. And you can see in his behavior and in what he reports that he's feeling very disconnected from other people, and this is coming out in his relationships at home as well. So I'll have some more quotes for you as we go through the presentation, but the other one is that the Children's Society, Young Minds and Youth Access believe it is absolutely crucial that early intervention support for young people's mental health is firmly on the agenda as part of the COVID-19 recovery plan. And we're talking not just about counselling services, although they are crucial. We're also talking about things like youth centres, activities for young people to connect with others, and other ways of boosting their mental health. So I had some nice quotes from young people, and we'll see whether we've got time for me to read some of those out at the end. But just to let you know the picture from our standpoint, in the 4 months when lockdown first happened, so the months including April to July inclusive, only 50 young people made contact with our service. In a normal period of time like that, you'd probably expect between 100 and 125. So it shows you that when the country first locked down, everybody, I think there was a kind of way in which the whole world perhaps sort of drew breath and stopped, and maybe it was so weird that people didn't contact us, or maybe young people didn't think that they could, even though we put it out really well on our website and things. But anyway, the referrals dropped off massively. And you'll see in a minute when I talk about some of the young people's experiences, maybe people actually found that first lockdown quite enjoyable in some ways in the beginning. But then from August through to November inclusive, our referrals were 161, which is a good sort of 40% up on normal. And we also started asking every young person who came to us the question, has COVID-19 and/or the lockdown affected your mental health? And 50% of them said yes. And then when they started counselling, an awful lot of the ones who said, no, I don't think it affects me, actually started to talk about loneliness, or how difficult it was going back to school, or how much of their education they'd missed, and how panicked they now feel about trying to catch up. So even though they may not have identified that it had affected them, we think that actually there's a very small number who haven't been affected at all. So some of the quotes from the young people in the first lockdown was that they'd found time to relax. One person said, I had more time with my family and we all got on better because everybody was less stressed. Another young person said, I did really nice things like read a book and walk my dog. Somebody else said, being at home was safe and the thought of going back to school filled me with fear. My anxiety levels started to rise and they became so bad that I almost dropped out of sixth form. So there were some people who found that they benefited, and we wondered whether some people, from what they've told us, some young people found things that actually helped, like self-care things that they discovered whilst in lockdown, or that they did more of in lockdown. At Time to Talk, we fully believe that mental health affects everybody. We all have mental health, just like we have physical health, and our mental health fluctuates depending on all the things that happen to us. Mental health isn't something that happens to them over there, to some different group of people. It's something that is relevant to every single one of us, and we move up and down the spectrum of, you know, from really buoyant mental health to really difficult mental health. And obviously some people get stuck more down one end of the spectrum than the other. But everything about what's happened with the pandemic and the lockdown makes anybody who is struggling with their mental health have a harder time, because all the things that they would normally do that lift them up, like play sport, like connect with friends face to face. And thank goodness we have the technology for people to still stay connected, you know, like we are today. But it was much, much more difficult to do things that normally would lift people out of depression. And of course, anxiety has increased because globally, everybody feels a level of anxiety about a pandemic. And then there's anxieties about, you know, individual situations and how that's going to affect people. And then, you know, there's things like not being at school and then having to go back to school. So I'm going to read you a few more quotes from our young people. I can't do any of the things that normally lift me up, like go out with friends, have a night out, get away, or invite people over. My parents have argued and fought more in the home, and this has been very frightening. I haven't been able to get away from family arguments. I have felt so isolated that it has made my depression worse, and I can't do any of the things that make it better. I felt angry and trapped. My depression has got worse and I feel so lonely. I feel like killing myself. Playing football used to keep me going, but now I can't do that. Obviously, that was actually in the second lockdown, that last quote. And then we've got some specific things, like one person said, I miss my nan. I'm really scared of her dying. I'm really scared because people at school are not being COVID safe, and my dad has health issues. I'm scared I'll take COVID home to him. So I've taken it as a smattering, and what I was hoping was that you'd have the presentation and then you'd be able to read those whilst I talk. So I've tried to combine me talking and reading those. I want to finish by saying what we felt has helped for young people, and then also to identify what's different about young people and their mental health versus adults. So things that have helped, young people have reported to us that all the apps, websites, and helplines have been very helpful. People have also reported to us that learning positive coping strategies and things like the 5 ways to well-being, the guidance that's out there about lifestyle and how that can support mental health, young people have reported to us that that has been very helpful. Young people haven't said this to us, but we saw some research about places that were recovering from natural disasters, and where young people became the most buoyant following on from the natural disasters were where they had been allowed to be part of the building back. So we feel it'll be incredibly important to involve young people, maybe to give them voluntary opportunities or to help young people to mentor each other. But we think if we could find ways, all of us, to involve young people in the recovery strategy, that will actually boost their mental health enormously. So finally, before perhaps taking any questions, young people differ from adults in mental health. Really, the principal way is because we know we've been on the planet long enough, well, myself especially, but we know that this too shall pass. We know that things come and they go. You know, we are able to look back at, you know, our parents' experience, and we are able to look at our own experience. We know that this is something that, okay, it may change the world forever, but we know that things change all the time. Because young people have a much shorter life experience, their sense of things being able to change is far less than ours, even though obviously they are very creative. That experience of change is different for them. And the other thing is, developmentally, they're less able to reflect on what is happening to them and what effect that's having. So although they can be helped to do that through counselling, and obviously as they get older into the sort of 14, 15, 16 and upwards, they can do it. But the younger end of the young people that we see find it very difficult to look at how this is affecting me, and being able to you know, put 2 and 2 together in that way. So that makes it more difficult for them to see how they can help themselves. So I hope that some of that has made sense, and some of it has been of interest. I've probably told you an awful lot of things you already know, but maybe that hearing it with the quotes and things has helped to make it clearer for you. Thank you for listening.
Thanks, Davina. That's terrific. We've only got a couple of minutes for questions from the board members. So if I go to Martha first.
Yeah, thank you. Well, actually, I'm particularly interested in that comment about involving young people in the building back, because I don't think that would have been something that would automatically have thought of. I just wanted to know, how are you feeding this into the council, particularly the district council? How much is your communication with them? Because obviously you've got a lot of expertise here. And I'm just wondering how far that's being shared, particularly with people that hopefully can, you know, can use it.
Well, we haven't actually had any forum. You're the first group that's asked us for our, you know, our knowledge on this. And we've tried, as you know, to get it from the young people rather than us. but we do of course have some contacts, like we have a small amount of funding through the Public Health Fund, so we feed into Linda at the PHF, so I could certainly feed this into her.
I think that would be very helpful. I think also we need to have a chat about the Mental Health Action Group as well. And there's some joint work on young people being done with the CCG, the Council, Public Health. So it seems pertinent that we hook you up in there, because this stuff is really important, and it's important we do it now. Adrian?
Yes, thanks. Thanks for Davina. I thought that's really fascinating. How have you, as Time to Talk, managed to cope with the increased demand?
Well, thank you for asking that question. We had some we managed to secure some funding from the National Lottery. Several of our counsellors are doing extra paid sessions funded for by the National Lottery. And we just got £7,000 from the CCG for winter funding recovery. So that's January, February, March. We need to use that money. And we're getting another group of counsellors to do some extra sessions to do that.
Thank you. Karen, you had your hand up first.
It crosses my mind, following on from what Martha was saying, that perhaps it would be useful to do a report, and then if one's got a report, one can put it under certain people's noses. I don't know whether Healthwatch could be involved in that. I mean, it would seem, it seems that we need to do something.
But that's certainly something I think we could have a chat about, Davina, if you're interested.
Yes.
Excellent. Mike, last question, then I'm afraid we're going to have to move on because we're running a little over time.
Thank you, Andrew. Mine is not a question. It is, well, first of all, to say, Davina, thank you very much for coming along and speaking to us this afternoon. It was very interesting. And the comment, I guess, is it's obviously interesting and disturbing what you had to tell us. But I was surprised to read in the press today that even preschool children are being affected by the COVID situation. And of course, they're not, I don't quite know how they will recover, in the sense that they don't really understand what's going on, but their actual behavior is being affected, it seems. So it is a very serious situation we find ourselves in, and I only hope that we can actually improve the mental health of all those involved. So once again, Davina, thank you very much.
Thank you, Davina. That was really, really excellent. And sorry for having to make it so short and sweet, but we just have to make sure we don't keep people on too long. These meetings can easily drag. So if we go to item 1, Mike.
Right, thank you very much, Andrew. First of all, welcome one and all to what, if my age in memory serves me correct, is our 3rd Zoom board meeting. We're getting quite used to it now, and I would like to think a little better as we go along. But anyway, thank you very much to all those who've registered to join us this afternoon. We'll quickly whiz through the members of the board and Healthwatch people, if that is all right, to introduce ourselves to you all. So, Michelle.
Sorry, didn't realise I'd muted myself. I'm Michelle Pace. I work for Healthwatch West Berkshire, and I'm an administrator and digital information officer.
Andrew?
Andrew Sharp, Healthwatch West Berks Chief Officer.
Alice?
Hi, I'm Alice Clifton. I'm the Development Officer.
Adrian?
Adrian Barker, board member, also chair of the West Berkshire Patient Panel, which is the forum for PPGs, and a patient leader at Berks.
Amanda?
Yeah, Amanda Cunnington, board member.
Judy?
Judy McCulloch, board member.
Karen?
Karen Swaffield, board member.
Lesley?
Lesley Wyman, board member.
Martha?
Martha Vickers, board member.
Nathan?
Nathan, digital and social media officer.
And a very special welcome to Paul, who's joined us for the first time in we can actually see and hear him. I know last time he was meant to join, but he had a lot of technical trouble. So Paul
Wilson, new board member.
And I think, I think that's everybody. Thank you very much. Right, so do we have any apologies for absence? I guess the answer to that is no, Andrew, is it?
It is. I think we're all here.
And do we have any declarations of interest that have not previously been disclosed and on record? No? Fine, thank you very much. So we'll move on to the minutes of the last meeting. They have been circulated. Does anybody have any corrections or alterations? Please let me know. No? Everybody happy? Okay, thank you very much. So Michelle, you can do the necessary if you would. Then we move on to matters arising. So am I right in thinking the first one occurs at item 8, coronavirus recovery? Andrew was asked whether he could send presentations around.
Yeah, we're just literally awaiting hooking up with John's campaigns and the rights for residents. And once the COVID-19 report and survey are fully done, we'll send those on because they seem highly pertinent.
Thank you very much. The next one is the work plan, which is on the agenda anyway, but Michelle has done what she was asked to do. And if I missed anything out, does anybody know?
Item 1, the next one down, I've got to arrange a meeting with Pete Campbell, Head of Education with West Berkshire Council to follow on. And I think in light of what Davina had to say, it becomes more and more pertinent. You know, she specifically mentioned children suffering arguments and things like that. And of course, the converse side of that is what happens to parents in the case of looked after children being taken away. Not a great deal of attention goes in that direction, probably should. So we will be following up with that.
Thank you, Andrew. Right, okay, then we'll move on to item 4, which is a report from the Chief Officer, Andrew Sharp.
Right, and in order, honestly, to try and catch up some time, and with most of the things on the agenda, I'll try and be as brief as I absolutely can be. I think chiefly, I just wanted to quickly reflect on 2020 as the most extraordinary year anyone, I think, probably has ever had. The pressures, the way life completely changed, all the things we took for normal disappeared. And in fact, even the way an organisation like Healthwatch operates just went completely out of the window. So from our standard sort of grabbing patient feedback publicly, going to lots of meetings and things like this, and actually meeting with the public, we were unable to do so. We repurposed into an information sharing organisation where we were bringing in information from the clinical commissioning group, the hospital trust, and sending it out, and then equally grabbing patient experience of what was happening and sending it back to the clinical commissioning group so as they can amend things and just be aware of where things weren't working. That process is still very much happening. So this morning we were meeting with the chief execs of Royal Berks Hospital. We've had similar meetings with the chief execs of Berkshire Healthcare, with West Berkshire Council, with hospital trusts outside the area, so Hampshire, Swindon, etc. So that process is very much ongoing, but we are trying to get back to a more normalised phase of work, as well as obviously looking at what's happening with the COVID recovery. And I just wanted to say special thanks to our very small, fabulous team, because despite all the stuff we've done, we've put out, I think, 50 to 60 plus newsletters. We've created a West Berkshire Diversity Forum working with Communities Reunited. We've created a West Berkshire Maternity Forum that didn't exist as a feedback mechanism for new mums who found COVID particularly tricky. We actually held the 5th Thinking Together event for mental health online, which seemed to be quite successful. We've recruited with our other Healthwatch colleagues a joint officer. We also, although it wasn't so much in the public, we managed to get Professor Donna Hall, who came up with the Wigan deal, which transformed how Wigan's occupancy and various other health measures changed, to come and talk to the Health and Wellbeing Board. So we appear to have done a heck of a lot, but in a very, very different way. The other things I just briefly wanted to cover off is we haven't had any complaints about our service in the last quarter. And what has changed? Lots, but I think most positive response was from our maternity report, with the news that Hampshire Hospital were looking to begin a service actually in West Berkshire for people accessing Hampshire Hospital maternity services. So I think that's really good news. And again, thanks to the partner report and Lesley especially. So thank you for that. So that's all I'm going to say, because I think most of the stuff's on the agenda, Mike, and we need to catch up some time.
Yep, fine. Thank you very much, Andrew. And I would add my words of congratulation and thanks to all the team, as you say, a very small team, but have done a phenomenal amount of work in the last few months, indeed the whole year. Right, we'll move on to item 5, which is interesting. That's COVID-19 care home visits. Over to you, Alice.
Hi, thank you, Mike. Well, we've so far visited 3 care homes, Birchwood, Nortrees, and Willow's Edge, and we've had feedback from them. So the care home survey is still continuing. Unfortunately, the 4th one we can't do because Walnut Close is now closing in January, but we're still continuing with the other care homes. So that's going to take place in the new year. And that's where we are at the moment.
Great, thank you, Alice. I'd just like to say what a fantastic job you've done in going to these care homes in these difficult times. I know you've been fully kitted out with all the appropriate PPE, and because of your experience in area nursing and so on. I think you've done a great job, and well done.
Thank you, Alice.
Yeah, I mean, the thing is that, to be honest, I had done the test as well, so that we have got evidence. I mean, to be honest, we had risk assessment before the going, the observations were done. So we've tried our best to be as safe as possible.
Fine. And now perhaps you'd like to continue and tell us about the planned Great Western Hospital visit.
Yeah, I mean, that's going to be, so this project is going to take place in February. It's working with Healthwatch Swindon and Healthwatch Wiltshire, and also Great Western Hospital. They are very, very keen for us to help them, and in view of their CQ Care Quality Commission rate. So they have been having a response whereby they've had to require improvement. So they are very keen for us to work. So that is hopefully will be taking place in February. And so we've been having regular meetings with Healthwatch Swindon and Healthwatch Wiltshire to make this happen as well. So that's been really, really positive. So watch the space for that one.
Sounds very interesting, yes.
Yeah, it's going to be virtual. So the hospital is going to help us with the surveys, and then we'll go from there.
Mike, I just wanted to add that 2 things again, some amazing work by Alice and the colleagues at Healthwatch Wilson Swindon, even in getting this off the ground, because the whole basis of Enter and View is that you get to go and see the place and smell the place and hear the place, which we clearly can't do safely. But with the aid of some technology, and actually I really want to commend Great Western, a hospital that is in a situation of requires improvement. It'd be very easy for them to sort of hide things and not be very keen on us going in to talk to them, and actually they're going out of their way to make sure that using iPads and trained staff, we get to actually talk to the patients who are in the hospital and find out what their experiences are. So I think that's remarkable. It'll be one of the first in the country to be done like this. And there is a glimmer of we may be able to do a little bit of it in person if the numbers are limited. So normally we would send in 2 people, to a particular place or a ward. We clearly can't do that because of PPE. It will be risk assessed to within an inch of its life. PPE and testing will be put in, because clearly what we don't want to do is be the organisation that takes in or challenges infection control. So I just wanted to emphasise, both in the work we've done in the care house and any work we do, we are super, super careful, and both the safety of our team, patients and public is absolutely paramount, and we will not compromise that if we can't do things online. But we have to be careful and clever in finding alternative ways and using post, and encourage people to write to us as well as digital to make sure we don't exclude anybody.
Just before we move on to the next item, Alice, is there anything particular so far come out of the care home visits you might want to mention?
I mean, one of the things that what's mentioned is about the visitings. I mean, they are really, really missing meeting the families and things like that. So hopefully, you know, the next when I go to visit other places, things might be better, because now they are saying that relatives can be tested. So hopefully that would improve. And what I know, we've also had issues about meals. A lot of people had, for example, the supper or dinner was given very, very early, about 4 o'clock, 4:30. And so that has also been highlighted to the care quality board. So, you know, so those are the few things that we've had as such. But, you know, I mean, majority of them are happy. And they, you know, when you ask them questions about COVID itself, you know, when it's happened, how did you feel? They say, well, you know, especially with the PPE, they were really happy that it's been done. It's, you know, they said, oh, it's for my safety. So, you know, they don't see. I mean, the one thing that I would turn on and also highlight is about the digital side of it. The only way they connect with the families is by phone. And, you know, I think there's some work there that we could make it better for them. And this is where Healthwatch youth is one of the things that we are looking at to see whether we can recruit more young people to help us work and help to go into the care homes and enable them to communicate better with their relatives.
Okay, thank you. Right,
Karen wants to ask something.
Yeah, in other areas, I've been seeing that they've been having quite a lot of screens, iPads and things where they've been. Is that happening in our local homes?
The screens, in the sense that separating from relatives, yes, that is taking place. The digital one, it's some. I haven't seen it with my visits, but this is one of the reasons why we've highlighted it as a way forward to make it better. But, you know, but also I am aware that there are projects that's taking place in West Berkshire, especially with dementia friends. They are doing something with digital stuff as well. So there's a lot of work going on. We just have to come together. But this, I mean, at the moment, we are looking at in Healthwatch about seeing whether we can go forward with young people to help.
Karen, we've raised at the Care Quality Board that digital was and remains important throughout COVID. The challenge is, though, that although the government has often bought a load of iPads, what they haven't recognised is that the staff working in the homes are rushed off their feet as it is. Lots of people aren't digitally capable. So hence we've suggested they look at putting in what might be termed digital buddies, who are obviously suitably tested and what have you, and perhaps one per home, to actually assist with this. And then you've also got some other problems that should and need to be dealt with about variable internet access. So you'll find that it's fine on perhaps one floor, but on floor 2 it isn't, and that effectively excludes residents from being in touch. So it's quite a hot topic for us in terms just generally of making sure that people are allowed to feedback and speak to their parents, their families, take part in groups and things.
It occurs to me, Andrew, that, I mean, if all the residents in care homes have a television in their room. So can we not get a channel, a local channel, so that they could see the relatives through that?
I think you'd have to ask Rupert Murdoch. Realistically, it's unlikely, because the cost of setting it up, by the time it was set up and passed by Ofcom, it'd take 3 years. The practical way of doing this is to actually have digital technology that can be taken round and people can actually use it and get used to using it.
One wonders, there is a local channel, isn't there?
Kennet Radio. Kennet
yes.
Radio.
Well, that's radio.
Radio, but there's also a tunnel that covers Thames Valley, isn't there?
Well, there is, but it's not going to be able to be interactive.
No.
No.
You're talking about interactivity, and you can't do that via television. It has to be via either. I mean, you can get things that will digitally cast to the television, but you have to be able to have that connection with the family, the group, or the person. So there are ways of doing it, but let's not go down the broadcasting route.
No, it needs some whiz kids, doesn't it?
It really does.
Oh, yeah,
it really does.
definitely.
Anyway, if we can go back to Mike.
Right, thank you very much. Very interesting.
I think Lesley, Mike had a hand up, and I know although we don't officially take questions during the meeting, I wonder if...
Oh, sorry, it's just a quick question. Do you know if any of the care homes have received the lateral flow tests yet?
Alice?
Sorry?
Do you know if any of the care homes have received the lateral flow tests? The quick 30-minute result tests?
Not as far as I know. I've not really asked that question, to be fair. So, I mean, and I think going forward would be a question that we can ask now.
However, in saying that Alice was tested before she went in, but it was still the classic 72 hours
the classic one.
wait, which is a shame. Sorry, Mike, back to you.
The lateral flow does have a very high failure rate, of course. But...
Yes, a lot of care homes are refusing to use them, I think.
Yes. Okay, thank you very much.
Thank you.
Right, we'll move on to the Coronavirus Recovery COVID-19 Survey and Report. Are you kicking off with that, Andrew?
Yes, if I might. Now, if people can remember, this was based on the survey we did back in July. We did it jointly with Healthwatch Reading, Healthwatch Woking for the first bit of 12 or 13 general questions, and then we asked another 28. I think we got about 300 responses in, and it varied and talked about all sorts of things. So access to primary care, access to secondary care, people's mental health state, why they did or didn't use the health services, whether they felt at risk, whether they volunteered for the NHS volunteers or the community hub, and what have you. So the report is getting to the point of we're nearly ready with a final draft version of that, and Karen is doing a fabulous job with that. We are presenting it to the unified exec of the CCG in late January, early February. But I think the key things that I took from that was that the initial pandemic response was problematic from our health colleagues, because they effectively stopped all the regular stuff. And actually, I think the real problem was, while they did an amazing job with the huge number of people who were ill with a brand new virus that no one had ever come across, by not communicating about the basic stuff of how you do a blood test, how you get a GP appointment, how you would get a scan, whether you should or shouldn't go to a hospital or a GP, there was an awful lot of mixed messaging. The messaging didn't reach out to hard to reach groups, be they the ethnically diverse, the disabled. There was very little put in place for people who were deaf. So places where we already had health inequalities were absolutely highlighted, and every public health report has said this. And I think that, it's really interesting. We had this mixed bit of people weren't accessing services through fear, and very interestingly, through not wanting to be a nuisance, because they felt very much there were other people who needed it more. But actually, again, a highlighted issue this has raised is that there was people who probably did need to do things, but were either scared, thought they would be a nuisance, or didn't think the service was open, who really should have. And we're finding this now. There's a bit of a tsunami of additional work going through. So I think, you know, you can talk to any of the professionals and, you know, they probably say we've learned an awful lot. But I think one of the really key things that has come out of our work is we need to make sure that all the lessons learned are learned and the information from patients goes somewhere in terms of what they consider to be important, what made them change their minds over doing one thing or another. So I really hope the good thing is that it is at least being seen at some fairly high levels in terms of the clinical commissioning group, NHS England and things like that. So, and it was good that we can do a little bit of parallel work with our colleagues in Healthwatch Reading and Healthwatch Wokingham, so we get a whole Berkshire West picture. Karen, is there anything you want to particularly add of what you've seen and read? I think you're on mute.
I think you've covered it, Andrew. I think we need to have a conversation about it and get it.
And I think some of the information we've had post the survey in terms of people's reactions, what we learned at things like Thinking Together, what we've heard from Davina and Time to Talk, it all probably go in retrospectively of the survey to just give a richer view. So with some patient case studies of where things have worked, where things haven't worked. So I'm hoping we can end up with quite a round,
what is difficult at the moment is some of the things that people have reported on, of course, have been ironed out. So one doesn't want to put any blame on anybody, because that's not productive, you know, going forward. It's about looking at the positive things, really.
No, it absolutely is. But once we've got the report into a half decent state, it'd be very helpful if the board members can have a quick look and see if they can add anything in from their own circles of contacts and things like this. And I think if anybody's got any particular feedback from the public they'd like to let us know about their COVID experiences, send it in to the usual email addresses or a postal address, and we'll see if we can about including it. I
think we'll have to call it. It's not just a report of the survey. I think we have to be careful if we're going to include all this other stuff.
Well, I think we did this with the maternity report, Karen. I thought that worked quite well, that even if we put these as appendix items, you know, the providers and commissioners really need to hear them. They're really, really powerful. That was what worked in our maternity report, was the actual real live stories that people could capture, as well as the statistics. So I think that it's important we do that. So I think we will hopefully have that published by February of next year, Mike, in a pretty complete form.
Excellent. Good. Thank you, Andrew. Right, we move on to item 8, the quality framework and the updating of the website.
Yes, so we had hoped to be putting into place the Healthwatch England quality framework mechanism in the last quarter of what year are we in, 2020, and also updating our website to the new Healthwatch England model. With all this additional work we've been doing on newsletters, reports, events, and what have you, I'm afraid our resources came to an end when it came to these two pieces of work, and as they weren't seen as mission or time critical exactly, we've decided to move them into early next year in terms of both of them, because our current website, though far from perfect, has done a pretty good job of getting information out there on a fairly regular basis. It's been updated 3, 4, 5 times a day. So thank you to the team for that. The quality framework's an interesting one because it applies to health watches around the country. So things like Kent will be doing exactly the same process, despite the fact they have 5 times the resources. So it's not exactly a level playing field. And the good thing that I think, Mike, you'd probably agree is when you actually look through it, the way we operate is pretty much in line with it, but it's a bit of an administrative process we have to go through. Don't know if you
absolutely. And then, to be pure and simple, there are far more important things at the moment that we are doing and need to do.
Yeah, I would agree.
With limited resources compared to some health watches. So I think it's just kicked into the first quarter of next year, and a sensible decision.
Yeah, thank you. Thank you for that. Has any of the board members got any questions on that? No.
No, okay. We'll move on to item 9, contact and issues report. Who's kicking this off first, Alice or Andrew?
I think I might kick this off because Alice can hopefully pitch in. So we talked about some of the things we've done. So obviously the maternity report was presented to the Health and Wellbeing Board back in September. It seems to have caused an appropriate reaction because we are still almost weekly hearing about maternity-based scandals around the country, which I find in 2020 hard to believe. Instead of a continual improvement in a service that has been around forever, we seem to be going backwards. And I think most worrying for me is the lack of the ability to learn or accept that if things go wrong, they can be improved. It really is in contrast to sort of how the airline industry looks at things. Instead of saying, if something did go wrong, you acknowledge it went wrong and you try and put it right and then you try and improve it. I think even last week we had a really serious case, not locally, but, where an entire system was basically covering up the problems.
Mm.
And while I don't in any way, shape or form think that West Berkshire is anywhere near that, it's really difficult to know if you don't get the honesty, the transparency. But I think the positive here is that we have excellent relations now with all the local trusts, with the possible exception of John Radcliffe, which is not very used in terms of maternity services. So I'm quite pleased with that. We've got fabulous connections in terms of health visiting now. We've set up the maternity forum, which has got 500 new mums behind it in the Facebook group, and we will ensure that maternity does not just get discussed when there's a crisis or on a 5-year basis, as it seems to be at the moment. So I think it's a watch this space, and also I think the board has to help us decide where next in terms of what we do with maternity and things like that. So Martha, you've got a hand up.
Yeah. Well, I was just thinking about your comments about, why aren't things changing? Why isn't service improving? About how it reacts when things go wrong. And I remember many years ago when I was doing my health visitor training, I think it was, having a presentation by a consultant, I think it was, on the whole business of the culture of the health service being discussed, that they don't sort of admit to being wrong, they don't apologize. It's just this fear of being wrong or being sued or whatever it is, and it seems to persist. And how do we change that? How do we get a different perception? We get more and more like the sort of American system where everybody's just looking out for problems so they can jump up and say, but I just think it's a cultural thing, and it would be great if we could be moving towards changing that in some way.
Well, I think I would agree, because I think wherever your answers end up lying in a lawyer's office, when it comes to healthcare, that's probably not the place you want to be. Mm-hmm. In terms of actually learning and improving things. I'm doing some work with the people that run our contract, the advocacy people, who also run the health complaints advocacy, funnily enough. And what we can't fathom is the disconnect between health complaints advocacy, learning and commissioning. There seems to be no direct correlation or connection, and that just cannot be right. That it's treated as almost a separate division, and you can almost see how and why you end up with these reports and incidents being covered up, brushed under the carpet, or barely mentioned. You go to any CCG board meeting, I doubt you'll even hear the word complaints mentioned. And I don't know how you get from that to where you need to be in terms of capturing learning, but I think we've certainly got to try. Alice, have you got anything you want to add on maternity?
The one thing that Andrew was talking about was about services. We're also looking at maternity and the ethnically diverse communities. Because one of the things that what has happened is NHS England has said that the services have not got to be looked at. So we are now going to be asking the question, what has changed? So that will happen soon as well.
Thank you.
I guess that's my question as well. I have my hand up. On a scale of 1 to 10, like, you know, when we kind of first decided to do the survey, it was against the backdrop of Shropshire and some of the other things that have gone on. So on a scale of 1 to 10, with 10 being taking it really, really seriously and, you know, having a good check of our own system to make sure there's no issues, and 1 being completely ignoring, kind of where do you feel we are in terms of system leaders taking this to heart and actually having a look? Because I feel like we've made some progress, but I'm trying to gauge what the next step is that we should do.
I think in September I'd be saying 6, but if you asked me today, I'd be saying 3.
Okay. So we kind of got some traction, and it's dropped back a bit now.
Well, also key personnel have moved who were very keen to take this on, and we now have a bit of a vacuum in the leadership. And I think what we've got to do is work out, with the feedback we're getting from our maternity forum, what we do with it, where we take it, and whether or not we can get Healthwatch England and other organisations involved, because I find it hard to believe that with 50% of the population absolutely bought in to maternity, how little attention it gets, considering the number of scandals. And you do sort of think, well, you know, if this was happening in cancer or A&E or something, I just think we'd be having public inquiries and judge-led inquiries, and I don't understand why we're not.
And it's not because we think there's an issue. We're not because we know there's an issue. It's just that we think we need to pay real attention to it. And Alice, actually, your point about the ethnic diversity piece with that is a way of getting that heard a bit more and raising it. So thank you.
Thanks. So Lesley, you had your hand up.
Yeah. I just wanted to say, I mean, I think to be honest, it's very encouraging that we were able to take the report to the Health and Wellbeing Board. And given that maternity is not something that is regularly discussed at the board at all, and initially it was quite lukewarm in terms of the reception it received, because it didn't kind of register on anybody's radar that there was a big problem. So just that sort of continued pressure, I think, that we're able to bring as Healthwatch, we've just got to keep on with that, keep on making sure that that the recommendations are revisited, and we said we were going to do this, nothing has actually happened, take that forward again. And just one other point I wanted to make, I think it's really difficult for that maternity forum to just kind of carry on and be successful, because it is really led by individuals. Those individuals really care, but they have their own issues, they have their own problems, and sometimes things aren't going right for them. So then things kind of die down. Maybe they don't have quite so many meetings. Maybe they can't get together for whatever reason, for personal reasons. So we have to make sure that we're supporting them as well, and making sure that we get back to them sort of fairly regularly, and being clear about what it is they can do and what we can do to help as well with them. And maybe, you know, bringing them into the MVP as well, and making sure that that connection is substantial and helpful. So that's.
Thanks,
But
Lesley.
it's not an easy task, but something
No,
that we
and
just can't let it go. I agree with you.
I think we have to keep it as top of mind as we possibly can, and also encourage people to feed back to us. And also, this is not about, you know, we're not witch hunting or anything like that.
No, not at
We
all,
want to
no.
hear the good stuff, so that we can let the providers know where it's working well, so that if it does, they can do more of that elsewhere and take the whole standard up rather than focusing on where things have gone wrong. So that's sort of maternity. Thinking Together 5, we held on the 19th of November. Hugely challenging to hold what would be a face-to-face mental health forum for those with serious mental health issues, other people struggling with their mental health, the voluntary sector, the professionals from health and the council. And we were genuinely challenged as to whether it would work, whether we could do it, because this is not often a friendly forum for that kind of thing. But with the help of a digital expert, Rob Cow, and Dynamic, our team, the board members, we actually managed to get, I think, 58 people involved in the call. We had 6 or 7 breakout rooms for people to discuss things. We will have a report on what was found. And the findings I thought were really interesting. So I think we were expecting a torrent of negativity in relation to mental health, but there were actually quite a lot of positives, and actually quite similar to Davina, perhaps from the first lockdown. People enjoyed the fact that their lives had been slowed. You know, they enjoyed the fact they were able to do things they hadn't been able to do. Some enjoyed the fact they spent more time with their family. That the anxiety of life in an odd kind of way seemed to have been turned down. But then equally the opposite of that was those who were affected seemed to be were affected much worse. There were people who were very worried, very frightened, very, very anxious, and didn't seem confident, you know, they could get help. And also something very interesting from our diversity forum, we asked people where they went for help, and I think of the 30 or 40 people who responded, not one of them ticked helplines. That admittedly was from an adult population, but I thought it was really interesting that, you know, in that community they didn't feel that the things that were being put out as a standard way of helping were of any value at all. So I think, you know, this is clearly something we've got to keep our eyes on, and obviously we've now scheduled, because it went reasonably well, we've scheduled to do another one February, March next year, which will follow on. And now we have the support of the Health and Wellbeing Board. We can look forward to having at least 2 Thinking Together events, hopefully in person, perhaps in the autumn, where we can really start to get into the nitty-gritty of what people need in this, what will be a sort of almost post-COVID world. And perhaps where the shift from only concentrating on GDP and growth as your only key metric to maybe something a bit more fulfilling, where people's mental health is taken more seriously, will help. Let's see. Voice of disability. Now, this sort of went a little bit off our radar, because if you remember, we took health and wellbeing, we made a load of recommendations. And the one thing we absolutely have to keep our eyes on is we have to take it back to the Health and Wellbeing Board in March of next year, with a view that we report back on, well, what's happened to the recommendations, what has been done. So very much like Lesley was talking on with the maternity report, you know, and I'm absolutely delighted that Paul, our new board member, who has more experience of this personally and from a work point of view than anyone on our board, is going to head this piece of work up. and we've already put him in touch with Royal Berks about their accessibility audit. It's hopefully going to the Skills and Enterprise meeting tomorrow. But Paul, can I just ask you to come in on this, because you've obviously read the report, you know where it is or where it had got to, and see where you perhaps think we need to go with VOD.
First of all, yeah, I just wanted to say big thanks to everyone who took part in putting the report together. From a disabled person, obviously it's good to see that these issues have been brought to the forefront again. I think we had a discussion during the week with Andrew about the Disability Discrimination Act and where we are now. It does seem that as a person with a disability trying to, I'll just pick something out of the report, taxis, trying to get a disabled taxi, to take a wheelchair accessible taxi, we're still unfortunately in that place where I was probably 20 years ago, starting out. So it's great to see the VOD report. I think possibly at the moment we've got to really probably focus sort of on the COVID-19 and the mental health side of things. From some of the Facebook groups that I help out with, the majority of disabled people at the moment seem to be crying out with their mental health rather than accessibility issues, which I guess, you know, we're going with the times at the moment and all the issues. So it would be nice for the accessible issues maybe to be sort of, I think in terms of the report, maybe we need to be knocking on people's doors a bit more, maybe having someone to chase the issues up and ask maybe why things haven't been changed. Certainly with West Berks, I've spoken to the taxi team numerous times and seem to get the, we'll review why our taxis are still not conforming. So it's a massive, obviously a massive piece of work, and it'd be nice if it was maybe broken down into maybe accessible sections, and then taken on maybe sections bit by bit. I think with it being such a big report, again, once it's even, I probably read it 4 or 5 times. There's still things on there that, you know, I've missed off from previous. So I think taking it forward, definitely breaking it down into sections, and then maybe getting a couple of people to knock on doors constantly. I think something like this needs someone constantly knocking on doors in terms of accessibility, in terms of transport, in terms of the healthcare side of things. So yeah, that's how I look at it. I think it needs to be, it's such a massive bit of work that's been done. I think just presenting it maybe, I think it's gonna, you know, it might come across as 10 years time we'll be in the same, looking at that report, will we be in the same, you know, in the same situation? So I think it needs someone certainly knocking on doors, asking if people need help, with accessible issues, even you know, in terms of maybe asking the right people to help out, maybe asking people with disabilities to help out in terms of the approaching councils, approaching, I think we also spoke about the construction of buildings, didn't we, Andrew? And said, you know, why not, when a building is designed, put someone in with a disability, once everything's been put in, ask them if they can manoeuvre around, if they can access the building. So yeah, I think it's a big bit of work, and I think maybe it needs to be putting someone there with a disability to actually put some of these issues directly to them, or you know, to the clients, and going from there. So.
Thanks, Paul. Can I just bring Karen in?
Yep.
There used to be a disability group, didn't they? But it's not anymore. I mean, I wonder if there's anything that we can do to perhaps get a group, bit like we did with the maternity group. I wondered if we might be able to get a group together of disability that might have some clout.
I think there's two things that, if you remember in the report, one of the things we asked and recommended was that the current Disability External Scrutiny Board that meets a couple of times a year reports to the Health and Wellbeing Board. Now, when we presented the report, they kind of turned that down and gave some reasons that they felt that disability would be a cross-cutting theme across every single policy. And I think what's happened is that disability has become invisible again, and the Disability External Scrutiny Board doesn't report to anybody, which is why these issues go unheard of. So I think in revisiting our recommendations, I think we probably need to find some more evidence and actually almost make it a, you have to do this, because you haven't made it a cross-cutting theme across every single policy. It's sort of, I mentioned this to Paul, it almost feels like when they changed and updated the Disability Discrimination Act into the Equality Act, there was seemingly this sort of, well, we've done disability, so we don't need to do it anymore. I think people don't equate the Equality Act with the Disability Discrimination Act. So although it is still basically the DDA, I think people almost think they don't need to bother. So hence why there's so many organisations who do have mixed issues with access. The fact you can't get powered wheelchairs into disabled loos and really obvious stuff. And, you know, Paul knows far more about these sort of issues that exclude people from daily life. But there is just this feeling that, oh, we did disability, we've done that, it's done, you know, we have all the drop curbs and...
Yeah, I'd agree.
Paul, is there anything you just want to end with on that one? About maybe the group, Karen's idea, and maybe linking up with the scrutiny board?
Yeah, I mean, it would be a great, I think it'd be a good idea to get maybe a few more people, diverse group across the board to get involved and actually maybe document and film their issues that they have on a day-to-day life. Because I don't think there's anything you can argue with a video of trying to get on a bus with a wheelchair and the bus rides off. Happened a couple of times for myself. Or phoning up to try and get a taxi and get told you don't have any wheelchair accessible taxis. So I think at the end of the day, video proof or, you know, documentation, diaries, I think are a great way of showing people that these issues are still there many years on, and that goes whether it be working in a working environment to you're every day trying to get excess of train and having to, you know, trying to get on a train and having to book it 24 hours in advance, or even a taxi 2 weeks in advance, which again has happened to me many a time.
Yeah,
so,
it's clearly not acceptable. So I think, Paul, we've got the essence here of a working party. So I think we need to take this away from the meeting and talk to the board about how we actually go about. So we know we have this deadline of March for the Health and Wellbeing Board. So I think we've got to be realistic in terms of what can we do in the time, what positive bits of evidence, and you know, effectively, do we need to create a version of the West Berkshire Disability Forum, a bit like we have done with maternity, a bit like we have done with diversity, that if there isn't a forum, do we need to create one? And maybe, so let's have a conversation with that. Judy, just a last point on this.
I would say, having worked in this area for a long time, that the time when the impact of people with disabilities was the greatest was when it was a user-led group that was actually running everything, and they had very good contacts within the council, and the council were very open at that time to listening to the user-led group. And although we might facilitate the development, I don't think we should see ourselves as the leaders of that in any way. I think we would have far more impact if we were enablers. So it helping
I agree.
work out how to set up, but not actually doing it or being directly involved. It's just enabling and letting it go. And it does need someone strong who is part of the disabled community, who is going to take that forward. But I have to say it worked best when there was also a proper disability structure within the council as well. And that's got long gone.
Yeah, it was interesting that at my meeting today, they talked about the fact they've actually appointed an officer to oversee this at Royal Berks. So we're going backwards in some places and forwards in others, but it's very, very, very mixed. So I just want to quickly touch on the last point because we're running a little bit behind time. The End of Life conference, which was postponed because of COVID, funnily enough, we had mooted to do this in perhaps March of this year. I still think there's some conversations to be had about when it's pertinent and not. And I asked the board to have a think about this. So if any members of the board want to comment on timing on the End of Life conference, I'd be very keen to hear it.
I think the point I've made before is, in my humble opinion, it would be better held in person and not virtually. So to me, that would dictate when we would be able to do it.
I'd agree with that, and I think that we have to be very careful that it's not seen as a response to COVID. You know.
Yeah, I think it has to be bigger than that. But I think, Karen, with the effect COVID's had, I think you'd struggle to escape.
Yeah. For
3, 4, 5 years, if you were just trying to escape COVID. Judy, you've got your hand up.
And I'd simply be worried by the number of things we're talking about doing in January, February, March already, that I think it's better to do something less often and better than to try and do too much at the same time.
Okay.
And I've heard those months mentioned 2 or 3 times within this meeting about other events. And in the end, we won't make any impact if we don't do it well.
Yeah,
no, you're quite right, Judy. Thank you.
Anyone else want to comment? No?
Okay, we move on to item 10, which is Alice talking about community engagement, the first item of which is ethnically diverse communities, which I take it is the new name for BAME.
Yes, it is. Okay, so we held an event on the 10th of September, which was the West Berkshire Diversity Forum, and we had 67 attendees, and out of that 47 were from the ethnically diverse community. We had three amazing speakers, and the topic was how COVID affected you, your family, and the community. And what the feedback that we've had has been that they enjoyed the event and they would like another one. So we've just been really positive. So hopefully that will take place sometime in the new year. I don't want to say it in the month, but it has been really positive. And I mean, we done polls, and from what Andrew was sharing we had interesting findings. So hopefully we will possibly we'll get a report out, and so that'll be good as well. So yeah, and I think with that, getting feedback from the community as well as doing the maternity stuff, so we are sort of covering the ethnically diverse community in West Berkshire.
The maternity forum, is that you or is that Lesley, or both?
Lesley.
I think we've pretty much covered it,
Yeah.
actually. I don't think we probably need to go through this again.
Super. Alice, CAMS?
No, CAMS. Michelle, you're the one who's good at that one because you're dealing with that one.
So I've put to, obviously we've had feedback about CAMS and the waiting lists and the services that people have been receiving, obviously during the COVID and lockdown as well, how, you know, everything's been pushed back. So I've been looking at other health watches to see what kind of surveys they put out to get some CAMS information. So I've actually put a survey together that Andrew needs to have a quick look at before I can circulate it to the board to see whether you guys are happy for it to go out. And then I was hoping that we could put it out over December, January time to possibly get some information in and put a small report together for February time.
I mean, this is relating to, we had already done a CAMS focus group some time ago. And so we are sort of following it through rather than doing something new. And, you know, so it is something that we've heard people saying it. So we really need to look into this now that Time to Talk has also shared things with us. So.
And also from the, I wasn't there, but in Thinking Together, the local MP, Laura Farris, also mentioned CAMS and mental health for younger being one of her things to look at for 2021. So it'd be a good time for us to have something to take to her as well.
Good. Dental survey?
I can pick this up very quickly, Mike. Dental seems to be one of the services that just got forgotten when the COVID planning took over. It still seems very much to be the poor relation. So this is obviously down to the nature of most dental treatment creates aerosols, which is really bad for infection control with COVID. So you have to leave surgeries empty for 45 minutes to an hour, which obviously reduces capacity. But the thing that's really troubled us is less so for the emergency things, which have been a challenge, but just the routine oral care, the fact that it's people are finding it hard to register for NHS dentists. We've had a couple of cases where people have rung 18 and 19 different dentists. So I think this has fallen off NHS England's radar. And also dental's always been treated as a sort of slightly different part of the NHS. The fact it's got a charging model anyway makes it different. Mm-hmm. But it seems odd that from a physical health position, we can rattle up Nightingale hospitals at no notice whatsoever, but we can't get people who've got raging toothache or root canal treatment, any treatment for 6 months. And I think what makes it harder, and one of the things maybe we will recommend out of this dental survey is dentistry is still commissioned centrally by NHS England. So the CCGs and the integrated care systems have no influence or control on it at all. And yet when you come to the overall health of patients, as most people probably attest, you've got raging toothache or a dental problem, everything else sort of disappears in terms of what your general well-being. And I just think I've just been really surprised that this just hasn't been picked up on as a serious matter. So again, we're appealing for more feedback from the public. We'll have our dental survey up and out, and if you can persuade and cajole and ask as many people as possible to fill it in, we'll hopefully produce a report and take it to the CCG, to the Health and Wellbeing Board, to frankly anyone who listen, and see if we can get something done. Phlebotomy is very similar, funnily enough. The phlebotomy capacity has been reduced to about 40 or 50% of its pre-COVID levels. Phlebotomy is basically your blood tests. So if you halve the capacity, you can imagine the effect this has had. And again, very similar in terms of time between appointments, but also key, the big challenge is the lack of trained staff. And this is across the country, they just aren't there. And it's having a major impact, and it's worrying people. We've had 4 cases of people really struggling to get even emergency blood tests, 2 from the MP's office. So I'm raising it again at planned care. I've raised it at primary commissioning. I've raised it with Healthwatch England, but I haven't seen a single piece in the media about it, which I think really telling, because things like blood tests are the kind of things that affect nearly all the population. Everyone's used to having them. And we've still got this odd thing that the odd GP surgery, no queue, no worries, can get it done. And then people with emergency blood tests are being given 3-week appointments. So there's something obviously not quite right. So we'll be looking into that. Volunteers and social media, very quickly, Alice, because we're running a bit behind time.
Yeah, I mean, we're still recruiting volunteers, especially young people. And we've also had 4 new volunteers who've come on board. So, you know, hopefully we will have work coming out. I mean, a lot of this is very hard to do what we are planning to do, but people are still interested. So which is really nice and positive. Social media, we're still busy on social media. Our numbers are increasing, and yeah, and we are engaging with the communities, and they are giving us feedback. So thank you for that. And
Thank you, Alice.
long may they continue.
Thank you. Okay, we move on to item 11, which is the Joint Health and Wellbeing Strategy Groups. Andrew, you?
So I'm going to race through this, Mike. We had the presentation from Sarah Rayfield, Dr. Sarah Rayfield, before the last board meeting. This is basically a 10-year health and wellbeing strategy that they are doing between West Berkshire, Reading and Wokingham and the clinical commissioning group. So there's lots of work being done. They've produced effectively 11 priorities based on the findings from various surveys, the data from public health in terms of what's absolutely key. And we're now at the stage where they want to actually test the priorities to see what the public really, really think matters to them and that they need to focus on. They're trying to come down to hopefully 3. So we're running a series of focus groups for the over 65s and for the maternity group, and Reading are doing ethnically diverse communities and young carers. Wokingham are doing learning disability and oh no, they're doing young carers. Who are Reading doing, Alice? They're doing ethnically diverse and
young people.
Young people, there we go.
Yeah, yeah.
So we've tried to, between the 3 Healthwatches, catch some of the harder to reach groups. There is a survey that will be going on our website, which is ready to go. So we'd encourage everyone to fill that in. The more feedback they get, the deeper the research and quality, what really matters. Sorry?
Is that a common survey to... Yes, because that's down on the CCG website.
Yeah, it's on the CCG website. It'll be on our website. They've created their own website as well, which I think is Happier and Healthier Berkshire. So look out for that. But really important piece of work, because prevention's in the absolute heart of the long-term plan for the NHS, and actually turning round how society's going, where it's going. You know, we've got this terrible situation of, you know, the first generation where the parents will be outliving their kids, if we carry on as we are, and we have to be able to do something about this, but it isn't going to happen on its own. So we need to make sure the public feeds back and tells powers that be what's important to them. So look out for that. It will be all over our social media, our website, and various other things. And the two groups happening this side of Christmas, I think. Adrian.
Yeah, I was going to say I'm going to offer to do some discussion groups with various other bodies, but I could do something with the Healthwatch board if they're interested. And excuse me, what I had in mind was to present the priorities that are being consulted on and have a bit of discussion on those, but then to stand back and look at how they might look in the context of a strategy, you know, what a strategy might look like and how those priorities might fit into it. I'm saying for the Health and Wellbeing Board, I mean, not to be exclusive, you know, anybody else will be very welcome, but just that I was thinking of doing something for people who already know something about these topics. So is that, I'm seeing a few nods. Is it worth, just very quickly, I was thinking either sort of like next week, Tuesday or Wednesday, or the following week, Tuesday or Wednesday. Any sort of days to go for or not to go for, and any times of day to go for or not to go for? If not, we can sort it out by email.
I think let's have a look by email. I'd love to see the board doing that, because then we could have an official sort of Healthwatch response as well, because, you know, we may find that data is driving in one direction and actually we're finding or thinking that something completely different should also be in there. But the richer the feedback, the better. And obviously, Lesley, you know, this formally from your area of expertise, so you can hopefully help.
Yeah. Just to say, I can't do Wednesdays, so but Tuesdays definitely. Yeah, I think that's a really good idea. Thanks, Adrian.
Excellent. Thanks, Adrian.
Okay, thank you. Item 12, Andrew.
Yeah, again, a really brief one. So our former Sustainability and Transformation Partnership has now been turned into an integrated care system, if you're playing NHS acronym bingo. They changed their chief exec earlier in the year from Fiona Wise to Dr. James Kent, who used to work for Theresa May as her health contact. He's now in charge. He's also now the senior officer for Bucks, Oxford and Berkshire West clinical commissioning groups. So he appears to be collecting hats. Disappointingly, Sam Burrows, who was effectively the operating chief officer of Berkshire West, has left. We are utterly unclear if he's being replaced. It is not looking like he is, but it's a little bit disappointing that the sort of information has just dried up. On a positive note, we have recruited and is operating a joint health officer, but the problem we're finding with the role is that the ICS is changing direction. So it's very difficult to work out what our joint officer should be doing when the ICS hasn't worked anything out itself. There was also a very interesting consultation paper from the NHS called Integrating Care, which is on the NHS website. It's a consultation with the public. It's open until I think January the 8th. There is effectively, they're talking about finally making ICS a legal entity and getting rid of effectively clinical commissioning groups. So that market model of commissioning being done at very small scale looks like it's disappearing. And very positively, that Healthwatch is mentioned twice in the paragraph about how they will control issues at what they term place, which I think at our level would be Berkshire West, although it might, I think it goes place, then locality, which is primary care networks, which is the GP surgery clusters, and then place is Berkshire West, and then I think region is the sort of ICS Bob entity, not to be confused with Blackadder or Catherine. Yeah, so shifting sands on this, so I'm afraid we're going to have to update, but I would encourage everybody to have a look at this consultation, respond to it if they think it's good, bad, and we will put it on our website and make sure it's there. And I wonder whether the board want to have a think about whether we want to respond as a board. So Amanda, you probably know more about this than anyone.
Just to add, I think, you know, in my view, this is a really fundamental piece of legislation that's being consulted on. And it's, as you say, the direction of travel's been there for a while to remove that purchaser-provider split and have the money allocated to ICSs and then be able to hold budgets in their own right. And not only what the CCGs have, but also have a regional kind of view on the specialised commissioning budget, so all cancer and things like that, and things that are a bit more kind of usually commissioned at NHS England level. So for me, it's kind of not unexpected because Simon Stevens has been acting like this anyway, but it's kind of making how people have been expected to act, actually making sure the funding flows and the kind of decision-making group is defined. And I think it is probably worth us responding just simply to keep that sense of place at the right level. And, you know, we were on the group with Adrian a few weeks ago where we had, we're talking about the ICS. And I think it is about just making sure that Healthwatch has got this role to be that voice of place when things could get rather large. If you think of place as being Bob, that's probably too big for really representing people's views from West Berkshire. So I don't think it's necessarily bad, it's just simply change, and we just need to make sure that accountability and transparency on how people are making decisions about places is kept at centre of focus.
Thanks, Amanda.
On to item 13 on the work plan.
Yeah, I didn't want to say too much about that because it's in the document pack. The only thing I'd just ask the board to have a quick look at, and bearing in mind Judy's comments, is whether between now and January we need to refresh it a bit in terms of what we are and aren't able to do. Because obviously things like the Great Western Enter and View visit weren't originally on there, but now are. But it's quite a tricky time to be juggling this, where we don't know where we are in terms of COVID, where we don't know where we'll be in terms of being able to actually get out and do things in person. And I think we can't omit, as I said, the work we need to do on things like digitally excluded people, getting actual items of post and letters out to people to get their feedback. You know, we have our free post service. We haven't, I would say that's probably the only thing I'm really critical of ourselves in. We haven't used it enough, and we probably should in the year coming up. So I didn't want to say too much more on that, but if the board can come and feed back to us in the next few weeks about the work plan, I'd be very, very grateful, and then we can perhaps refresh it at the next board meeting.
Okay, thank you, Andrew. Right, item 14, the exciting developments going on in the area, Royal Berkshire Hospital and the Basingstoke Hospitals, Andrew.
Do you want to pick this up, Mike?
Yes, certainly. Well, I guess most people will be aware that as part of the 40 new hospitals scheme that both the Royal Berks and Basingstoke Hospital, or the Basingstoke Hospitals, are in for a large chunk of money to do something. And they have, I mean, RBH have got, is it 5 or 6 options? I can't remember how many Hampshire have got. Hampshire seem to go down the route of wanting a brand new hospital, probably located on the, what's that, the western end of Basingstoke,
Junction 7
of the M3, while I think the original Basingstoke Hospital will still continue in some minor form, as would Andover and Winchester. Royal Berks have got, I'm not quite sure actually where they're pushing at the moment. They've got a lot of options, one of which is a brand new hospital. In Basingstoke's case, I think they have actually got a piece of land in mind. I don't know whether the owner is necessarily willing to sell it, but whereas Berks, I don't think, have got anything obvious in mind, although I think there are some limitations as to where it might be. So it's quite exciting in terms of what's going on. Another option, if they can't go for a brand new hospital, would be to redevelop the Royal Berks site, but that obviously has some limitations. There are lots of information, consultation, whatever, on the various websites, Royal Berks and and Basingstoke Hospital. And I think both in the next couple of weeks will be putting their case for anything to the Treasury before they move on to actually going out to consultation and refining the number of options to a preferred one or two. So it's quite exciting. I guess Hampshire have been quite good with their consultation advisory patient panels that they hold seemingly quite regularly. RBH have got a slightly more limited list of people that they involve, but the information is on the website, and for those interested, I suggest you actually look. Anything you want to add, Andrew?
Yeah, I think you'll find links to both these projects on our website as well. There is a survey, certainly you can still fill in for Royal Berks. I think they're being somewhat disingenuous with the 6 options, because the first 2 basically just to me look like capital spending on the existing project and very little change. So I think there are actually only 3, because if they do options 1 or 2, I think basically they aren't doing anything. There's no new hospital, it's smoke and mirrors. 3, 4, 5 and 6 I think are variations on that, and as you get close to 6, which is the Greenbelt site where they start from scratch, there seems to be a reticence to really focus on that in the way Hampshire has, because I think they're not sure the Treasury would back it. And also there's some pushback from Reading Council, not necessarily wanting the site moving from where it is or outside the boundaries, it would appear, of Reading City Council, despite the many shortfalls of a landlocked site with no parking that disturbs residents, that's difficult to get to in traffic, with not enough car parking. So I think from a West Berkshire point of view, most of the people who've had a look at this have all been saying, for goodness sake, move it and take the opportunity to do the right thing. But whether or not that gets anywhere, I would urge everyone to fill in the survey with their thoughts. That's all I want to say, Mike.
Okay, thank you very much. And obviously, the problem with, I suppose, either new hospital would be the time frame in which it would be built. So I think the government is keen on having something that shovel ready that they're more keen on, rather than starting from scratch. Okay, thank you. We now move on to questions from the audience, public. Has anybody got a question they would wish to ask? If you do, perhaps you could identify yourself and any organisation you're representing. Do I see any? No?
Have we answered everything?
I'm here on a watching brief.
Well, did you find it interesting?
Yes, it's nice to hear a bit more from that end of town. I'm in Reading. I look after the self-help mental health group.
Oh, fabulous!
And work with other mental health organisations in both in Reading and Wokingham and in Newbury.
Oh, brilliant!
Namely, Mental Health Mates.
Yeah.
Which is a good link nationwide, never mind just locally. Something that needs to be spread a lot wider if we can.
Well, I would say let's make a contact with our Thinking Together events going forward there, because I think that would be really important. And the fact we'll probably be doing it virtually will not matter that you're in Reading, as today you'll be on screen with us. So that would be very helpful.
Yeah. Well, I've already spoken to Newbury Mental Health Mates, so I'll be visiting them as soon as it's physically possible to do so.
That is fabulous.
I was all last year and before, since they first started. It's very important to me that we do work together as a county and keep the links open and support each other.
I agree. But thank you very much for coming today. And as I said, I hope you found it interesting and
illuminating. Yes, it's nice excellent. To hear different voices on different subjects. You can just accidentally, just by chance, pick up an idea about a subject that's bothering us, and you've already got a solution for it. And that just happens just by being in the right place. So
I agree. Thank you. Anyone else got any final thoughts or questions? No.
Are there any other business from members of the board?
Mike, I would just ask the board members just to hold on when we close the meeting, just for 30 seconds.
Okay, certainly. In which case, if there is nothing.
Have we got a date for the next meeting as yet, Michelle?
Yeah, I've been looking at March the 8th. Obviously, we'll set it up as an online meeting unless anything changes between now and then.
Right, well, I will declare the meeting closed and would normally say now we break out the tea, the coffee, the biscuits and the mince pies. But sadly, this is not something we can do this December. So I will wish you all keep safe and have a Merry Christmas.